I think just having an adult who acknowledges that I have been through mental health challenges, it's hard, you're not alone, I understand what you're going through, just helps them realise that what they're going through is somewhat normal.
Hi, this is MindChat, a podcast about mental health by and for young people. I'm Lauren, your host. In today's episode, we're speaking with two amazing peer support workers, Nicholas and Paige. Nick and Paige use their lived experience of mental health to support young people across Sydney Children's Hospitals network. Thanks so much for joining me today, Nick and Paige.
No worries. Thanks for having us. Such a nice intro as well.
So to start, could you explain what a peer support worker does and how your role fits into the care we provide here at Sydney Children's Hospital network?
Yeah, for sure. Essentially, a peer worker is someone who has their own lived experience of mental health. They try to help other people going through similar challenges they're going through at that time, and they basically do that by showing them that they're not alone, and by not necessarily having all of the answers, but more so kind of walking next to them and being in their corner, trading stories about mental health. All with the aim to build hope, or at least enough confidence to start thinking about the future again. In terms of how it fits into our network, SCHN, we fit in on the mental health wards here by running like safe groups on the ward where young people can share stories safely. We talk to young people individually, gather feedback, we advocate for them, and we just spend time out there trying to build rapport, get to know them, let them make fun of me, which they're really good at. And we also do home visits as well, after discharge sometimes, if they want it,
Yeah, wow, that sounds incredible. So I guess for the next question, Nick, I'll start with you. What inspired you to become a peer support worker? Was there a moment or experience that shaped this career path for you?
It's a tricky one because I didn't have a peer worker at all growing up and going through the mental health challenges. I went into the mental health system and quickly tried to get out of it as quickly as I could, basically. I kind of pulled away from a lot of services and just figured maybe it was something about me. But luckily, I returned back to the mental health system and I found two amazing psychologists back to back who really helped me unpack my beliefs about myself. And reflecting back to that period where I pulled away from the mental health system, the things that got me through it more so than the clinical people who helped me down the track definitely were, comments from co-patients that made me laugh, comments from my friends who had no idea about mental health, but they tried to inspire me in their own loving way. Terrible advice from my dad, which he meant with all his heart and actually helped. Like, all these things were just human interactions that inspired me massively, and I really could have done with that kind of connection on those wards and in the community. So, yeah.
Yeah, wow, that's amazing. I could imagine it could be quite isolating for you in that situation. So to have someone to have that really strong connection with could have really benefited you.
For sure, it did, yeah.
And Paige, what about you? Can you tell us how your personal journey led you to this role and why it's meaningful to you?
Yeah. So throughout my late primary school, early high school years was when I was kind of most struggling with my mental health. So it's very much the same age bracket with the young people that we're working with now. I was very reluctant to engage with a lot of services. I had lots of really bad experiences with services. So I think having someone there who was just kind of validating my experiences and telling me that, they've experienced something similar or, it's not all in my head, that would have really, really helped me. Just wanting to work with people who I really uniquely relate to has been a really, really big part of my journey into becoming a peer worker, and it's definitely not what I expected at all, but I think it teaches me something new every day.
Yeah, that's amazing. And I think so many young people would benefit from having peer support workers like yourself and Nick. So that's really incredible that you guys have taken that experience and used it to produce something really beneficial to other people. One of the unique aspects of your work, as I've just said, is drawing on your lived experience. So how do you share your experiences with young people in a way that is both safe and empowering?
To make it safe and empowering, I guess first of all, we try to ask permission before we're sharing our stories, definitely. We make sure the balance is by far weighted towards being about them, of course. I would normally only bring up conversations if I had permission first, but also if it was relevant and if they weren't in a moment which seemed like it was really fragile and like they were trying to get something off their chest. I wouldn't choose that moment at all. I'd give them as much space to finish what they're getting off their chest first. But sometimes there will say comments as well, like, I'm not sure if anyone else has gone through this, and they'll be in a bit of despair about that. So that's a beautiful time when we can jump in and be like, well, I actually had that reminded me of something from my experience, and helping them with that feeling of isolation. The fact that we can just share that we've gone through something similar immediately, I think, empowers them a bit to see that they can figure it out themselves because someone else has. And if they see someone like me getting through it, they're like, well, maybe I can definitely do it.
How do you facilitate group work in comparison to individual one-on-one conversations?
I guess if it's individual, we'll be talking to them in a confidential space. So ideally, there's not people walking through the room. They're not being interrupted. I let them guide it in terms of what they want to divulge. We try to be very mindful of the fact that a big issue in mental health is young people having to repeat their story a lot of times. So if they've just had a review and I'm seeing them soon after, I'm letting them know usually that they don't have to repeat their story if they don't want to, but I'm absolutely someone that is happy to hear about anything they want to talk about. If it's a group, we make sure there's a clear agreement beforehand. We have rules, for example, of not sharing details about traumatic events. We encourage them to use broad labels, words like, a traumatic experience as opposed to anything more specific in a group especially. And we try to focus on the impact on them or how it felt trying to recover and focus on the recovery and all the confusing questions that come up around that. That's the beautiful part where they can learn comforting stories to make them feel less isolated and even sometimes learn positive, inspiring things from other people on the ward.
And Paige, do you find that sharing your story helps build trust with the young people you support?
I've definitely had experiences where there's a young person I'm working with and they're, not engaging really well with the team, or they're just feeling very isolated most of the time. And because most of the time I'm meeting them in hospital, so it is a very isolating environment. You're away from your family, all of your comfort it's not there with you. So it is super isolating for them. And I think there have been times when I've been sitting in a room with someone and they will be, really not engaging well with me either, but kind of talking to me a little bit about how they're feeling quite isolated. And when I have permission to start to share my story, I see them just kind of brighten up a little bit and open up. I think just having an adult who acknowledges that, I have been through mental health challenges, it's hard, you're not alone, I understand what you're going through, just helps them realise that, what they're going through is somewhat normal, it's okay. And there's a little beacon of hope as well in there.
I can imagine it would be just truly wonderful for you guys to see when someone has that little spark go off in them. You both have mentioned how you work with young people, both in hospital. You go out and do community visits with these young people. Do you also work with parents or families as part of the support process? And if so, how does that look?
Yeah, for sure. So within our role description, we're hired to be working with the young people. But as they're young people, there's mostly liaising is all through parents. And we're communicating with parents on the ward incidentally, just passing by, and outside the ward and at home visits as well. Parents will speak to me after. Often they'll probably try to ask some questions and I'll have to run through confidentiality and explain there are boundaries there. But those conversations are also very telling that the parents, they love their children and they want, generally speaking, they really just want them to be well. So they're also looking for some hope from us, I think, sometimes. They're really interested in our experience of mental health too. And just the thought of the young person's parents being less stressed is a nice thought too for the young person. I think, you put on the oxygen mask before you help. It's a terrible analogy that always gets used in mental health, but it's true. You want to put on the oxygen mask before you help your young person. So the fact that it helps everyone is good, I think.
Yeah, no, for sure. Well, the analogy does make sense.
It does.
So what makes peer support different from other forms of mental health support like therapy or counselling?
I guess we come at it from a non-clinical lens. That's the main difference. And we're allowed to share our stories, as we said. We're coming at it from a place of on the same level. So we're not coming at it from a place of authority where we have accessible qualifications or skills, which is good because we're learning as much from the young person as they are from us. And that's the whole environment we try to set up.
You mentioned that peer support can give hope to young people. Could you share an example of how that has played out in your work?
Yeah, so I think I mentioned before that, a common theme is just feeling isolated and feeling this sense of hopelessness. I think a lot of the young people that I work with have that sense of hopelessness when they're coming into hospital and I'm meeting them for the first time. And something that I found was really powerful to hear when I was young, and something that I find is still really powerful to say and I feel like resonates really well with the young people that I work with, is saying now, like, I love my life. I'm grateful I'm here. There's nothing that I would have changed because it made me the person that I am today. And, while those experiences were painful and hard at the time, I am grateful that they happened because, like I said, they made me who I am. And I think just being able to say that gives them just that little bit of hope, like allows them to, I guess, reframe their mindset, because most of the time they're thinking, this is never going to end. I'm always going to feel like this. And I think being able to say, I was there, that's exactly what I thought, and that is not how it played out for me, is really powerful.
Yeah, wow, that's really, really great to hear. Trust is another thing I think is so important in mental health work. And as you mentioned previously, when you see young people who are struggling to engage in the services, I imagine that comes down to a big lack of trust. So how do you go about building trust with the young people you meet, especially in situations where they might feel scared or vulnerable?
For sure. I think the first thing we try to do is maximize the amount of time on the ward. It's the most fun part of the job, so it's really easy to do that. Spending time with the young people so that we can prove that it's not something that worth being afraid of or being nervous around, mental health. We're there to talk about anything, but also just to actually get to know them and have fun with them between activities and stuff. So playing games, basketball, whatever, just being on the ward, getting to know them better. They can learn about us, which a lot of young people want to do. I think also getting a chance to be as transparent as well about the hospital and the unit we're on is a huge part of that as well. So if they have questions about why there's a certain rule, we'll gladly be honest and be like, this rule, I don't even know, this rule doesn't make sense to me. We'll try and be as honest as possible and then get that information back to them and, treat them as equals in that way. So that's what works the best for me.
I think choosing parts of your story that are important for the young person to hear, generally my story, like my whole story, isn't the most relevant for every single young person to hear. So I'll choose bits of relatability. Often I'm not just telling my entire story in one big chunk. They'll say something like, this happened to me and I'm not feeling good about it. I feel really isolated because this happened to me. And I'll be able to say, look, I really relate. This happened to me when I was younger, or this is happening to me right now, or things like that. So I'm sharing those little bits that are relevant to each young person, but also remaining like really positive with my story, acknowledging that there are challenges, but at the end of the day, things have changed for me. So there's, that little sliver of hope for them.
Thank you so much for that. Before we wrap up, what advice would you give to young people who are struggling with their mental health but might feel hesitant to seek help?
I would just say that if you're struggling with your mental health, please know you don't have to struggle on your own. If you need help, reach out for it because your voice matters, your story matters.
And for families or friends supporting someone going through a tough time, what would you say to them?
I think it's really important to acknowledge that they're doing a really hard thing, and they're doing a good job just by being there and caring. Stay educated and also look after yourself. You have to look after yourself before you're able to look after someone else.
Nick and Paige, thank you so much for sharing your stories and giving us insight into the incredible work you do as peer support workers. I'm sure it will be very beneficial to not only the young people listening, but their parents and carers.
Thanks for having us.
Thanks so much.
If this topic has raised anything for you, there's help out there. Talk to your family, friends, school, and tell your GP if you're feeling stressed, anxious, or down. You can call the Mental Health Access Line on 1800 011 511 or go to the Head to Health website, headtohealth.gov.au for services and resources. This podcast is brought to you by Sydney Children's Hospitals Network. Thanks to all of you out there for joining us today. We look forward to your company again in our next episode of MindChat. Until then, bye for now.